Pas de soleil, 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 pas de soleil.
I feel so pretty. I actually feel so pretty right now. Oh, I need to be looking at the camera. Oh my gosh. No, then it's not right. Okay, I need to look at the camera, not look at my face. Look. Focus. Focus. Look at the camera, please. Yo, guys. Doing YouTube is tough, okay? Doing YouTube is tough. Okay. Oh yeah, I need to relax now. I like this hair, guys. Look at my hairstyle. I'm so in love with this hair. But anyways, let me do this now. Hey guys, welcome to my YouTube channel. It's Nurse Sally's here and I am back with another video. Today I'm doing a sit down video, as you can already see. And if you are new to my channel, thank you for coming over here and checking Nurse Sally's out. If you are a returning subscriber, I appreciate you, honestly. I really appreciate you. And if you're not subscribed yet to my channel, please subscribe. I invite you to subscribe, have a look at my other videos that you have missed out on, see if there's anything that you like, something that resonates with you, and click on the red button below. I am now at 828 subscribers, so I am super excited about that. I'm so happy. I'm so happy, guys. Thank you so much to the people that have been supporting my channel. I really appreciate it. I always tell you guys that your support doesn't go unnoticed. So I really appreciate it. If you are subscribed to my channel, you support me, you watch my videos, you like, you comment, you share. I love to see it. So without any further ado, let me get into today's video. So today I will be talking about a topic that is not spoken about enough. Something that causes a lot of emotional trauma to a lot of women. Something that is very traumatic for women to go through this thing, but it's something that happens quite a lot. It's very common. So that's why I felt the need to do this video. So if you are interested in finding out what I will be talking about, that is such an important topic today, please stay tuned to this video. Okay, so today I am actually talking about miscarriages. A lot of people have heard about them, and they've actually happened to quite a lot of people, which is something that might be new to a lot of you, but miscarriages are very common, and some people have miscarriages without even knowing that they're having a miscarriage. So it is something that is quite common, and we do need to talk about it a lot more. They cause a lot of psychological trauma to a lot of women, a lot of couples as well. So yeah, that's what I'll be talking about today. And if you have had a miscarriage before, my heart goes out to you. My heart goes out to you. It is something that I wouldn't wish on anyone. It's very sad. It's very sad to see it happen. And therefore, it's something that really compelled me. I really felt so compelled to talk about this, to educate women so that they can know what miscarriages are, how they happen, and why they happen. Because when you're more informed about something, it just changes everything. It just changes everything. So, yeah, that's why I decided to talk about miscarriages. And today I'm going to talk about the incidence rate of miscarriages. So, I'll talk about the stats, the statistics. How common are they? What is the rate of miscarriages? How much do they happen? And I am going to talk about the different types of miscarriages, and I will talk about the risk factors, things that put women at risk to have miscarriages. I will talk about how miscarriages are managed, and I will end off in this video by talking about practical things that you can do to try and decrease your risk of getting a miscarriage. Because one thing we need to remember is that sometimes there's just nothing that you can do to stop a miscarriage from happening, especially once it's already happening. But I will talk about some things that we can do to decrease the risk of getting a miscarriage. And then I will just talk about some points that I want women to keep in mind, and practical steps that they can take if they see they might be having a miscarriage. Yeah, things that you should not ignore. You should definitely act on when you see them happening. So yeah, this is going to be a video that is very, very informative. So stick around, listen till the end, and don't forget to give this video a like, thumbs up, subscribe to my channel, and share this video to as many people as possible, because I obviously want this information to reach a lot of people. And also don't forget to leave a comment if you've had a miscarriage before. If you are comfortable sharing it, then you are very welcome to share your experience with us down in the comment section. Or if you want to send a word of encouragement to anyone or to other women out there who have had miscarriages, you're also very welcome to do that. And yeah, so without wasting any time, let me get on to talk about the first point of this video. Okay, so let me talk about like the stats with miscarriages, and I'm going to be looking down because I have my points written down on my notebook. Yeah, so please don't mind me. So firstly, I looked up different articles, and they had a lot of information about the incidence rate of miscarriages. But one article said that about 23 million miscarriages happen worldwide every year. Just think about that, 23 million. Like, that's a huge number. And this is telling us something, that miscarriages happen quite a lot all over the world, and they are affecting a lot of different women in different parts of the world. And then one other article said about 8 to 15% of clinically recognized pregnancies end in miscarriage. And it's very important that it says clinically recognized pregnancies, because other people are pregnant, but when they have a miscarriage, they don't know it yet that they are pregnant. So it's actually more, the percentage is actually higher of the pregnancies that actually end up in miscarriage. So when we take note of the people who knew that they were pregnant and their pregnancies were clinically diagnosed through things like an ultrasound, or someone knew that they were pregnant because they did a pregnancy test and they did blood tests and an ultrasound to confirm the pregnancy. And then if we include even the women that didn't know that they were pregnant by the time they had a miscarriage, so the incidence rate increases to 30%. So just imagine that, like 30% of all pregnancies 30% of all pregnancies may end in miscarriages. So that's quite a high number, actually. That's quite a high number, actually. The majority of these miscarriages, if we're looking at the whole 30% of pregnancies that end in miscarriage, they happen in the first trimester, which is in the first 3 months or the first 12 weeks of pregnancy. And one article said it's about 80% of the miscarriages happening in the first trimester. So a lot of miscarriages, they happen in the first 3 months of pregnancy. So that tells us something about the first 3 months. The first 3 months are very crucial in a pregnant woman's life. You need to take a lot of caution in that first 3 months and be cautious about what you do, about what you take into your body, and keep on the lookout for a lot, right? Because of that high rate of miscarriages that are in the first trimester of pregnancy. So now let's go over to my second point, which are the types of miscarriages. Firstly, let's talk about the signs and the symptoms of a miscarriage. So, if you're having a miscarriage or you're about to have a miscarriage, you might have things like cramping in your lower abdomen that feels like period pains. It may be cramping that comes and goes, right? So you feel a cramp now, maybe it lasts for a minute or so, and then it goes away, and then you go about your activities. It comes back again after a few minutes, and it comes back again after a few minutes. It starts to get stronger. The pain starts to get stronger over time, and the intensity as well. And the contractions or the pains, they come closer together. So the pain that you would feel in a miscarriage, it's more or less similar to the pain that you would feel if you are in labor, right? Because when you are in labor, you have regular rhythmic contractions of the uterus. So it is like that with a miscarriage as well, especially if like you are at the later stage of the miscarriage. So these contractions might start like very small, and you might not like pay that much attention to them because they just come and they go away like for a long time. But once they start coming closer together, you might start to actually notice that, no man, there's something happening. I'm feeling something in my uterus. So yeah, then that might also progress to now you having vaginal bleeding as well. The blood can either be like fresh, red, and bright, or it can be like brown. It can start maybe pinkish and then it becomes brownish at a later stage. Or sometimes you might just start having that light vaginal bleeding without any abdominal cramps. And then later on, maybe the cramps might come, or you might start with the cramping and then the bleeding. So those are like more or less the signs that you can look out for when it comes to a miscarriage. So now let's talk about the first type of miscarriage, and it's a complete miscarriage, right? So with a complete miscarriage, here's a scenario that can happen. You might be having abdominal cramps, and you might be starting to have like some bleeding, right? And then you go to your doctor or your gynae, they do a sonar to check what's going on. Is the baby still there? And then the doctor might find that your uterus is empty. There is nothing in the uterus anymore. There's no fetus and there's no heartbeat. That would mean that you have bled all the products of conception, which is the baby, the placenta, and everything that's supporting the pregnancy. So that is a complete miscarriage where you've had the cramps, you've bled, clots came out, maybe you saw some fetal parts and everything came out, and by the time you do a sonar, there's nothing in the uterus anymore. And then the other type of a miscarriage is an incomplete miscarriage. So let's say you started having the cramps and you started having the bleeding. You go to your gynae, and then you realize they do a sonar, and then they realize that, okay, you are passing some clots, but there are some products of conception that are left inside the uterus. So not everything has come out. but things are still inside the uterus. And then another type of miscarriage, it's when you are having a threatened miscarriage. So with this type of miscarriage, the miscarrying or the loss of the pregnancy has not happened yet, but it probably will happen in the next few hours or next few days, but it hasn't happened yet. So a possible scenario would be something like you start to have abdominal cramps, and then you have light spotting. And then you go quickly to see your gynae, they do a sonar, and they find that the baby is still there, and there is a heartbeat as well, but you might have a miscarriage maybe in the next few days or the next few hours if the cramping becomes worse and the bleeding becomes worse. Then another type of miscarriage that you can have is an inevitable miscarriage. So already the word inevitable, it's telling us that this is going to happen. We cannot stop it, right? So possible scenario, you might start to just have like bleeding from the vagina, right? Bleeding from the vagina, you are 10 weeks, for example, or 12 weeks, or 7 weeks. You start having like excessive bleeding from the vagina, and then you notice that as something that's wrong. You immediately go to your gynae, and then your gynae maybe does an ultrasound and finds that, okay, the baby is still there and there's still a heartbeat. However, when your doctor maybe does a vaginal exam and puts 2 fingers into your vagina, they realize that your cervix is opened, right? And we don't expect the cervix to be opened if you are not in labor. Once your cervix is open and you are pregnant, it means that you are in labor, and the more you continue to have abdominal pains, contractions, it's going to continue to open, right? So that's an inevitable miscarriage. And usually if you're having these symptoms and you go to your gynae and you figure out that you're at this point where it's an inevitable miscarriage, unfortunately, nothing can be done about your pregnancy. Nothing can be done to save your pregnancy at this time. It's going to happen. It's very unfortunate. It's very unfortunate. But yeah. And then the other type of miscarriage that you can have is, it can be a missed miscarriage. So you knew that you are pregnant, and let's say you found out that you are pregnant at like 6 weeks of pregnancy. You did a pregnancy test. Let's say you did a sonar as well. You found a heartbeat. You knew that you were pregnant. There's a baby. Then let's say you have another appointment scheduled with your gynae to do a sonar, maybe like a bit later on. And then when you do the sonar, you actually realize that there's no longer a heartbeat after there was a heartbeat in the beginning. So that would be a missed miscarriage. And then also with the missed miscarriage, it could be a scenario whereby you found out you are pregnant and you were having pregnancy symptoms such as fatigue, nausea, vomiting, cravings, and all those things. And then now all of a sudden, as time goes by, you don't feel those things anymore. So yeah, those are the type of miscarriages that you can have. Yeah, and those are the symptoms that you can have as well when it comes to miscarriage. So how is a miscarriage diagnosed? So as I've mentioned, as I was talking about the different types, an ultrasound will be done, and there are 2 ultrasounds that can be done. It's an abdominal ultrasound where your gynae will put a probe on top of your abdomen. I'll insert a picture here, and they will try and find the heartbeat, find the baby, find the placenta, and all those things. And then there's also a transvaginal ultrasound. So this one, a probe is inserted inside your vagina, and And then they also check for the same thing. Is there still the fetus? And usually the transvaginal ultrasound is used if like your pregnancy is still very early on. And then another thing that they can do to diagnose whether you're having a miscarriage is they can do blood tests and check for the levels of a certain hormone that is called HCG in your blood. So when you are pregnant, there are high levels of HCG in your blood. But when you're having a miscarriage, you might find that your HCG levels are dropping or they are going down. So usually that's how a miscarriage is diagnosed. And how is it treated? How is a miscarriage treated? So back in the day, everyone who's having a miscarriage would be, for example, if you're having like an incomplete miscarriage, what would usually happen is that they will take you to have a surgical procedure done, which is called dilatation and curettage, or DNC. Which is a procedure whereby they open your cervix, they dilate your cervix and open it, especially if they can see that it's an inevitable miscarriage, or for example it's a missed miscarriage that you have, and a sonar was done and there was no fetal heartbeat, and the contents of the uterus now have to be emptied because the baby is no longer alive. So then they would do this procedure called the DNC, open up your cervix and insert an instrument that can scrape out the contents of the uterus or suction. So that was what was being used back in the day, which over time they realized that it has quite a lot of complications. It can cause scarring of the uterus, and it can even cause the cervix to weaken, and it might really badly affect future pregnancies. So then now the treatment that is used for miscarriages is expectant treatment or medical treatment. So that's used more now, and it's usually like the preferred method of treating miscarriages. So with the medical treatment of miscarriages, they will give you medication. For example, they'll give you misoprostol. It's also called cytotec. And that medication will cause your uterus to contract and take the contents of the uterus out. And that would be used in cases whereby you are having an inevitable miscarriage or incomplete miscarriage. So for example, if you're having like an inevitable miscarriage and you're bleeding a lot and you're having the abdominal cramps, your cervix is open, the fetus might still be there, and there might still be a heartbeat, but perhaps the heartbeat is like very low, and the prognosis or the chances of the fetus surviving are very low. Then they might give you the misoprostol or the cytotec to make those contractions even more effective to take the baby out and end the pregnancy. They might also use this medical management, for example, if you are having an incomplete miscarriage, whereas some contents of the uterus, they did come out and the baby's not alive anymore, but there are certain things that are still left inside. And if they don't come out, they will put you at risk of having an infection or like bleeding quite a lot, and you're losing a lot of blood. So then they will use the misoprostol to sort of like speed up the process. And then obviously then they would use this medical management if you had a missed miscarriage as well. And then the other treatment option is expectant management. And this can be used if you're having like a threatened miscarriage. So you're having the spotting and some abdominal cramps, or maybe you just like having a lot of spotting early in pregnancy. Yeah, so your doctor might give you medication that's usually given like to maintain the pregnancy, but it's like the bleeding over time is getting more and more. and it's just not stopping, then you would be given time. So time, let's say you start bleeding today, and you don't have any abdominal cramps. You go and see your doctor, your gynae, and he might say that you might be having a threatened miscarriage. And then he will maybe tell you, give it a few hours, maybe like 24, 48 hours, go on bed rest, no sexual activity for the next week or so, and maybe your gynae will give you an appointment for like 2 weeks to see the doctor. And they will say something like, if your bleeding continues, you can come back. Or they will say something like, if the bleeding stops, then you come and see him or her after 2 weeks. And then you can continue with antenatal care if the bleeding eventually stops. So that's expectant management. You weigh things out, you see what's going to happen. Is the bleeding going to stop? Is it going to continue and get worse? So that would be in the case of like a threatened miscarriage, then that expectant management would be used to give the body time and to see what's going to happen. Yeah. So what are the causes of miscarriage, or what are the causes of miscarriages? So most miscarriages are caused by chromosomal abnormalities. So that means that there's some abnormalities in the genes of the baby that is being formed in the womb. And the message to make chromosomes, it comes from both the parents, the mother and the father. And if there's something wrong with any of the genes, whether it's the mom or the dad, and also in the forming of those genes, then we'll have chromosomal abnormalities. And one of those chromosomal abnormalities that's very common, it's Down syndrome, where there's an extra set of chromosomes than there should be. So things like Down syndrome, which like a lot of people, they know about Down syndrome, things like Turner syndrome. Yeah, there are other ones. But so some of those pregnancies, they miscarry spontaneously because the chromosomes are abnormal. And it's really just because maybe that baby was just not going to survive for a long time, was not going to live for a long time. They were going to have gross physical abnormalities that were just maybe not going to be conducive for life. And so then the body just excretes that pregnancy. So yeah. And then other miscarriages are caused by certain medications that are taken very early on when a woman is pregnant, and they are teratogenic. So they can cause abnormalities in the baby in that very crucial time, that first trimester, when like a lot is forming and you're taking medications maybe that you're not supposed to, maybe because you don't know that you are pregnant, or things like smoking in that first 3 months of pregnancy, which can cause a disruption in the chromosomes and the genes. Things like drinking alcohol in pregnancy, your diet, your exposure to chemicals in the environment that are not good for the baby. Things like that can cause you to have a miscarriage. And then other things, so that's mostly your first trimester miscarriage causes. And then now other things like in your second trimester, miscarriages that can happen in your second trimester. It could be the cause of like a weakened cervix, possibly because of surgical procedures that you had long ago, maybe to diagnose things like fibroids and what else? Endometriosis. Because with those, diagnosing those surgical procedures, sometimes it involves you going to theater, like doing that procedure that I mentioned in the beginning, the dilatation and the curettage, where your cervix is open, and then it might weaken your cervix, and then later on when you are pregnant, then your cervix it's prone to just opening before the time. And then so other miscarriages in the second trimester can be caused by things like your blood pressure, if you have high blood pressure in pregnancy, if you have diabetes, poorly controlled diabetes, medical conditions like lupus, where your own body attacks the fetus. What else? Yeah, and then also things that are like inside the uterus that I've already mentioned, things like fibroids, endometriosis, where there are growths on your uterus that like affect where the placenta is placed, that affect implantation, or as the baby grows bigger, they cause bleeding. So that might put you at risk of having a miscarriage. So yeah, those are some of the things that can cause miscarriage. And then another important one that I don't want to forget to mention. Booba! I'm recording a video. Cool.
Moments later.
So one other thing that puts a woman at risk of having chromosomal abnormalities, which is very, very important, guys, is age. Age. So, and we're talking about the extremes of the ages. If you have a baby when you're too young, and if you have a baby when you're too old. So if you're less than 20 or above the age of 35, you have a higher risk of getting a miscarriage because of chromosomal abnormalities, or having a baby that has Down syndrome, especially like the extreme of your ages, 35 and above, 40 and above, then you have a higher risk of having chromosomal abnormalities and having a miscarriage. And some other miscarriages, guys, that happen, they are because of an unexplained cause. They cannot find any problem with your uterus or its structure. You don't have any medical conditions, and you don't have, like, you go for genetic testing and they find that you don't actually have any problems in your genes. You and your partner, you're both still young and healthy, and they just happen. So with those miscarriages, we call them idiopathic miscarriages. And then another thing that can put you at risk of having a miscarriage is having a previous miscarriage. So if you've had a miscarriage before and then you fall pregnant again, your risk of getting a miscarriage is higher than that person who has never had a miscarriage before. So yeah, and as you can see, guys, with some of these risk factors and causes of miscarriages, some of them, there is something that we can do about them and we can prevent, but in other cases there is nothing that we can do. So practical things that you can do to try and decrease your risk of having a miscarriage. And because I've already said that a lot of miscarriages are caused by chromosomal abnormalities, especially in the first trimester, try and ensure that you plan to have kids or fall pregnant at an age at a good reproductive age. For example, between the ages of 20 and 35, if you're planning to have kids, try and have your kids within that time frame and age frame. And ensure that if you are trying to have a baby, don't smoke, don't drink alcohol, and both you and your partner preferably be in that same age group of 20 to 35 so that you can eliminate that age factor, right? And also your body mass index, whether you're overweight or obese, that can also affect how the hormones in your body are working as well, and can put you at risk of having a miscarriage. And this I forgot to mention, actually, it's one of the risk factors. So try and get to and maintain a healthy body weight before you actually try and fall pregnant. And then something else that you can do to prevent those chromosomal abnormalities is to take prenatal supplements. Folic acid, take prenatal folic acid while you're trying to fall pregnant, just to try and eliminate those chromosomal abnormalities. And if you make sure that when you realize that you are pregnant, you go to your gynae or your midwife as early as possible, guys. Firstly, to determine where is the pregnancy. Is the pregnancy in the uterus? Because sometimes the pregnancy can be outside of the uterus in your tubes, and that can result in an ectopic pregnancy, which would also present itself similarly to a miscarriage, because you might have pain, abdominal pain, maybe on one side of your abdomen where your ovary is, and you might have the heavy bleeding as well. And then you might also be having something that's called a molar pregnancy, where there's been implantation in your uterus, but instead of a baby forming, an embryo forming into a baby, it forms into cells that are a tumor and will not result in a baby. But your stomach grows, just that it's not a baby that's being formed. So yeah, ensure that you start attending clinic early, get a sonar done, find out, is there a heartbeat and is the pregnancy situated in the right place? So that you can also be given that advice to take prenatal vitamins, and your medical conditions will be checked. And you will be, if needs be, you will be switched on to medication that is safe for use in pregnancy. Because as I said, some medications, they are teratogenic to the baby and they might cause deformities in the baby. So you don't want to take certain medications in the first trimester of your pregnancy. That's why you need to go and seek healthcare advice to make sure that your medication is checked, your condition is checked, and you can be switched on to better medication. If you have things like epilepsy, you have diabetes, you have high blood pressure, if you have lupus, any kind of medication, you need to have it checked. And then, yeah, so very important, guys. Booking early in pregnancy, I've mentioned this, I've done a whole separate video on this. So it's very, very important. And also, you will be told about the danger signs in pregnancy. If there's abdominal cramps and they are constant, and you have vaginal bleeding, so yeah, it's very, I can't stress it enough, guys. It's important as soon as you find out that you're pregnant, which mostly as soon as you miss your period. As soon as you miss your period, take a pregnancy test. If it comes out positive, go and do the sonar, see your doctor or your midwife, check out your medication, so that you can even be given lifestyle advice. Stop smoking, don't drink alcohol. Yeah. So yeah, guys, this thing of miscarriage, a lot of people actually, they find out about miscarriages when it actually happens to them. But it's something that's very common. It happens a lot. And that's why I decided to do this video, because I really wanted people to be more aware of miscarriages. And don't think that it was your fault, especially if you are trying so hard to take care of yourself during your pregnancy, and you were taking your prenatal vitamins, you were keeping yourself fit, eating a healthy diet, you within the age range, you and your partner. Sometimes miscarriages, they happen and the cause is not known, and it's really not your fault. It's really not your fault. And sometimes nothing can be done to stop the miscarriage from happening. As much as, we'll tell you, look out for bleeding, look out for low abdominal pain, and sometimes you will go very early on to get these things checked out, but you might still have a bad outcome. So it's something that's very, very saddening. It's very traumatic. It's very like stressful, but it happens, and my heart really goes out to a lot of people who are going through this thing or who have went through it before. But the good news is that a lot of people who have had a miscarriage, especially in the first trimester and early miscarriage, they go on later to have healthy pregnancies and give birth to healthy babies. So just because you've had a miscarriage, don't think that it's the end. Don't think that it's the end. A lot of people, their first pregnancies, some of them, they ended in miscarriage, and others, they just had miscarriages without even knowing, but they later go on to have normal pregnancies. So don't despair. If you've had a first trimester miscarriage, that doesn't mean that you shouldn't try again. And depending on your healthcare provider, they might say wait 3 months before you try again, and others might say as soon as you have a normal period, you can start trying to have a baby again. But yeah, there is hope. There is hope. And yeah, man, so we're keeping everybody who's going through a miscarriage currently in our prayers, and we really hope that you and your partner find the strength to get through this very painful and emotional period of time. Yeah, just know that you're not alone. A lot of women, they go through this thing and they recover and they heal. But we are remembering those babies that their lives ended in miscarriage. And yeah, we wish you pregnant women all the best in your future pregnancies. And we really hope that you can get to enjoy your babies and have healthy and positive pregnancies that result in a live baby. So yeah, that's all I wanted to talk to you guys about today, and I really hope that you found this video very informative. I hope you guys are going to engage with me in the comment section. It's very lonely if you guys are not engaging. So please leave a comment. It's nice for me to know that, you know what, someone appreciates this information that I'm giving out. So yeah, and I really hope you enjoyed this video, and if you did, please give it a thumbs up. Please subscribe to my channel. Please share this video on your social media, and don't forget to click on the notification bell. I love you guys so much, and I'm going to see you on my next video. Bye.